Hey, it's Dr. Scott from Chiropractic Associates in Long Grove, Illinois. Today I wanted to talk to you with open up with a question. Where is the pain coming from? For the last several weeks we've been talking about the connection between the spine, the spinal nerves, and where those nerves go. And the reason I want to mention this question is because it's quite enlightening to a lot of people to realize that about 34 to 36% of pain, which is felt in our extremities, meaning our arms and our legs, actually comes from the spine. It isn't that there's a primary problem in our wrist. It isn't that there's a primary problem in our elbow or our shoulder, but there is instead a primary problem along our spine that's affecting the nerve tissue, various areas of our spine, that's then radiating that pain down into our arms. So this is a study that was done in the Journal of Manipulative and Physiological Therapeutics that showed that almost 40% of the pain that we experience in our extremities has its origins in our spine. Now, how does that happen? You might recall a couple of our previous posts where we talked about the connection between the nerves that are exiting in our neck, for instance. Well, those nerves control all the muscles, ligaments and tendons, things like that down our arm. So you can appreciate now that if we have a problem with one of the cervical vertebrae, if they're not moving smoothly, if they're not, lying properly, that it could irritate local nerve tissue, and that nerve tissue goes where? Down your arm, that the pain might be felt in your arm. Same thing is true for the lumbar spine, so the lower back. The lower back nerve tissue supplies bowel and bladder, reproductive organs, but importantly, those nerves in your lower back go down your leg. So as a consequence, if the hip and pelvis are not properly aligned, causing irritation to the nerve tissue exiting the lumbar spine, those nerves go down your leg. And as a consequence, you might experience pain in your lower extremity. So give this a consideration. Nearly 30%, nearly 40% of pain that is in our arms and our legs actually has origins in your spine. Now, if you treat those problems in your elbow, treat those problems in your wrist, knee, and ankle, and the problem is not originating from that spot, is your treatment going to be effective? Exactly right. It's not going to be effective. So you need to visit the chiropractic office to get assistance with a spinal origin of your arm or leg pain. I'm Dr. Scott with Chiropractic Associates in Long Grove, Illinois, and we look forward to seeing you in the chiropractic office really soon.